Your cholesterol test came back normal. Your doctor barely glanced at it, gave you a quick nod, and moved on to the next topic. But here's something that might surprise you. A completely normal-looking cholesterol number can still be hiding real risk, and a slightly high number isn't always something to panic about. Today, we're counting down the 5 things about cholesterol that almost never get explained properly, starting at number 5 and working our way down to the one that might matter more than everything else on this list combined. By the end of this video, you'll understand your own cholesterol panel better than most people ever will. Before we jump in, here's the quick promise of this video. No scare tactics, no confusing jargon, just 5 things about cholesterol explained the way they should have been explained the very first time you ever saw them on a lab report. Number 5, your total cholesterol number on its own barely tells you anything useful. Here's the thing, almost nobody explains clearly. Total cholesterol is just one combined number made up of several completely different components added together. It's a bit like being told a sports team's combined final score without knowing how many points came from defense versus offense. 2 people can have the exact same total cholesterol number and walk away with completely different actual risk levels, depending entirely on how that number breaks down underneath. Total cholesterol combines your LDL, your HDL, and a portion of your triglycerides into a single figure. If someone has a total cholesterol of 200, that could mean high HDL and moderate LDL, which is a fairly reassuring picture. Or it could mean low HDL and high LDL, which tells a very different story. The number 200 looks identical on paper in both cases, but the person behind it could be in 2 very different situations. This is exactly why doctors don't just look at the total number anymore, even though it's often the headline figure most people fixate on. The real story is in the breakdown, not the total. And this is also exactly why so many people walk away confused when a doctor says something like, "Your total looks fine, but let's talk about your LDL," because nobody ever explained that the total number was never the full picture to begin with. Number 4, not all LDL cholesterol behaves the same way, and this is where things get interesting. LDL gets called bad cholesterol so often that most people assume any amount of it is simply bad news. But here's what almost never gets explained. LDL particles actually come in different sizes, and the size matters just as much as the total amount. Picture 2 types of particles moving through your bloodstream. Some LDL particles are small and dense, almost like tiny, compact grains. Others are larger and fluffier, more like soft, puffed-up particles. Research has increasingly pointed to those small, dense particles as more likely to slip into artery walls and contribute to plaque buildup over time, while the larger, fluffier particles tend to pass through the bloodstream with comparatively less tendency to embed themselves the same way. This means 2 people can have the exact same total LDL number on their lab report, and yet have meaningfully different real-world risk, depending on which type of particle makes up most of that number. It's part of the reason why some doctors now order more advanced testing, like an NMR lipoprofile, for patients with a strong family history of heart disease, even when their standard LDL number looks only moderately elevated. Let's make this concrete with an example, because it's much easier to understand once you picture 2 actual people side by side. Imagine 2 coworkers, both in their early 50s, both get their yearly blood work done, and both come back with an LDL of 130, considered borderline by most standard guidelines. On paper, they look identical, but one of them has a diet heavy in refined carbohydrates and sugary drinks, which tends to shift LDL particles toward the smaller, denser type. The other has a diet built around whole foods, healthy fats, and fiber, which tends to favor larger, fluffier particles. If both of them stopped at the standard lipid panel, they'd walk away with the same borderline label and the same generic advice. But if either of them got a particle size breakdown, the actual risk picture could look meaningfully different between the 2, even though the basic number on their report was exactly the same. Here's a question worth pausing on for a second. Has your doctor ever mentioned particle size to you, or has every conversation about your cholesterol stopped at just the total LDL number? If you're like most people, this is probably the first time you're hearing that not all LDL is created equal, and that's exactly the kind of gap this channel exists to close. Number 3, having extremely high HDL isn't automatically something to celebrate. This one tends to genuinely surprise people because HDL has been marketed as good cholesterol for so long that most people assume more is always better. For a long time, that was the general assumption in medicine too. But research has shown something more nuanced. While moderately elevated HDL is generally associated with lower cardiovascular risk, extremely high HDL levels, especially far above the typical healthy range, don't necessarily continue providing extra protection. And in some studied populations, unusually high HDL has actually been associated with unexpected outcomes that researchers are still working to fully understand. This doesn't mean high HDL is dangerous or something to be afraid of. It simply means the old, oversimplified idea of the higher your good cholesterol, the better, no matter what, isn't quite as straightforward as it was once presented. HDL's actual job is to help transport cholesterol away from your arteries and back to your liver for processing. But the relationship between HDL quantity and real protective benefit turns out to be more complex than a simple straight line. If your HDL comes back unusually high on a routine panel, it's not a reason to panic, and for most people, it remains a reassuring sign. But it is a good example of why cholesterol as a topic resists the simple good number, bad number framing most people were taught. It's less like a single test you either pass or fail, and more like a full picture made up of several interacting pieces. This is also a good moment to mention something that trips a lot of people up. HDL numbers can shift for reasons that have nothing to do with long-term heart health at all. Certain medications, alcohol consumption patterns, and even some genetic variations can push HDL higher without necessarily reflecting the kind of protective effect people assume comes automatically with a high number. This is exactly why doctors increasingly look at the overall pattern across your whole panel rather than treating any single number, including HDL, as a complete verdict on its own. Number 2, triglycerides are the number on your cholesterol panel that almost nobody pays attention to, and that's a mistake. If you've had a cholesterol panel done, triglycerides were almost certainly on it, sitting quietly below the LDL and HDL numbers, usually with the least amount of explanation attached to it. But triglycerides tell a very specific story that neither LDL nor HDL can tell on their own: how your body is currently handling sugar and excess calories. When you eat more calories than your body needs in the moment, especially from refined carbohydrates and added sugars, your liver converts a portion of that excess into triglycerides for storage. A triglyceride number that's creeping upward over time, even while LDL and HDL look stable, is often one of the earliest signals of developing insulin resistance, the same underlying process connected to prediabetes and rising A1C, which we covered in an earlier video. This is exactly why triglycerides deserve their own attention instead of being an afterthought at the bottom of the report. Elevated triglycerides combined with lower HDL is actually a recognized pattern associated with metabolic risk, sometimes even more relevant day-to-day than LDL for people whose main lifestyle factors involve diet, activity level, and sugar intake rather than genetics. Think about how this plays out for someone whose diet shifted gradually over a few years. More takeout, more sugary drinks, less home cooking, nothing dramatic, just a slow drift that happens to a lot of people without them really noticing. Their LDL might stay roughly the same the whole time because LDL responds more to the type of fat in the diet than to overall calorie or sugar load. But their triglycerides can climb steadily during that same period, quietly reflecting exactly what's been happening on the sugar and refined carb side of things. If they only ever glance at LDL and HDL, they'd miss the one number that was actually telling them the most relevant story about their day-to-day habits. Here's a question worth sitting with. When's the last time you actually looked at your triglyceride number instead of skipping straight to LDL and HDL? If your honest answer is never, you're in the same position almost everyone is in. This number quietly reflects your day-to-day habits more directly than almost anything else on the panel, and it rarely gets the spotlight it deserves. Number 1. For some people, genetics matters more than diet, and no amount of willpower changes that. This is the point that changes how a lot of people think about cholesterol entirely, and it's the reason this one earns the top spot on this list. Most cholesterol advice assumes that diet and lifestyle are the primary drivers behind your numbers, and for a large portion of the population, that's genuinely true. But there's a specific genetic condition called familial hypercholesterolemia that affects a meaningful number of people worldwide, where LDL cholesterol runs persistently high from a young age, regardless of diet, exercise, or any lifestyle factor at all. People with this condition can eat an extremely clean diet, exercise consistently, maintain a healthy weight, and still have LDL numbers that would normally be associated with someone eating a very different kind of lifestyle. This isn't a failure of willpower or discipline. It's a difference in how the body processes and clears LDL from the bloodstream at a fundamental genetic level, often traced back to a specific gene affecting LDL receptor function. This matters enormously for anyone who has ever felt frustrated or confused after doing everything right and still seeing an elevated LDL number. If you have a family history of early heart disease, particularly if a parent or sibling had a heart attack or was diagnosed with high cholesterol at a notably young age, that's a conversation worth having directly with your doctor, because it may point toward a genetic pattern rather than a purely lifestyle-driven one, and it may call for a different approach than diet and exercise alone. Picture someone who spent years doing everything the health guidelines recommend, cooking most meals at home, walking daily, keeping added sugar low, staying at a healthy weight, and still getting an LDL reading that their doctor keeps flagging as high. For a long time, this can feel discouraging, even a little defeating, especially when every article and every well-meaning comment from friends or family assumes the number must simply reflect diet and effort. But once family history enters the conversation, and it turns out a parent or a sibling was also dealing with unusually high cholesterol from a young age, despite a similarly healthy lifestyle, the picture shifts entirely. It stops being a story about failure and becomes a story about biology, one that calls for a different kind of conversation with a doctor, rather than another round of the same lifestyle advice that was never going to be the deciding factor in the first place. Here's the last question I want you to sit with before we wrap up. If your cholesterol has stayed stubbornly high despite genuinely healthy habits, has anyone ever brought up family history or genetic testing as a possibility? Or has every conversation stopped at eat better, exercise more? I'd genuinely like to know in the comments, because this is exactly the kind of gap that leaves people feeling like they're failing at something that was never fully in their control to begin with. So there you have it. 5 things about cholesterol that rarely get the explanation they deserve. The total number alone doesn't tell the full story. LDL particle size matters as much as the amount. Extremely high HDL isn't automatically something to celebrate. Triglycerides deserve far more attention than they usually get. And for some people, genetics plays a bigger role than any lifestyle change ever could. If this helped you finally make sense of a lab report you've seen for years without truly understanding it, that's exactly what this channel is here for. Taking the numbers, the tests, and the terms that get mentioned in passing during rushed appointments and explaining them properly the way they should have been explained the very first time. We've already covered the blood pressure number most people overlook and the blood sugar number that can warn you years in advance. Now you understand the full picture behind your cholesterol panel too. Let me know in the comments which number surprised you the most, and I'll see you in the next video, where we uncover another one of these hidden numbers hiding in plain sight on your own lab report.